Thank you, Chair Vanderwall, Vice Chair Thompson, and members of the committee. My name is Russell Jacobowski, and I'm Senator Jonathan Lindsey's executive assistant. I'm honored to speak today on Senate Bill 95. Senator Lindsey regrets that he cannot be here today, but he previously committed to an event honoring veterans this morning. Senate Bill 95 started from a simple premise: healthcare costs are too high, and at the same time, healthcare outcomes are not good enough. In fact, as Americans, we've reached a point where nearly 20% of our GDP is spent on healthcare. Over recent decades, we've actually seen key health outcome indicators such as life expectancy drop. In other words, we are concurrently seeing some of the highest healthcare costs ever, while our benchmarks of success are declining. Senate Bill 95 is not a silver bullet, but it is a key step in the right direction to help tackle healthcare costs and improve outcomes. This bill does three things. First, it requires covered entities to fully comply with federal price transparency laws regarding healthcare. Second, it codifies some of the same standards in state law. This addition can also be made in a substitute that we believe is before the committee. Senator Lindsey welcomes that addition, as it will make Senate Bill 95 even stronger. Third, it strengthens incentives for compliance by protecting consumers from collection actions when they receive health care and it is found that the provider was not in compliance. The overarching question: why is it so important to get providers in Michigan fully on board with price transparency? When patients and healthcare purchasers can see upfront prices, it allows them to shop and make meaningful decisions about where and how they get their care. This puts pressure on institutions to become more efficient and to improve their standards of care. Medical price transparency legislation has received broad bipartisan support from President Trump to President Biden, from Indiana Governor Mike Braun to Vermont Senator Bernie Sanders, from blue states like Colorado and red states like Ohio. In our own chamber, the Michigan Senate, this bill has passed twice with strong bipartisan support. Last year it passed in lame duck, 33-0 unopposed, and it passed again this March, 35-1. Again, this bill is not the end-all be-all to solve Michigan's healthcare cost problem, but it is a foundational building block if we begin to solve our healthcare pricing crisis. I'll do my best to answer any questions you may have, and Senator Lindsey has encouraged me to have any members follow up as necessary with him. We have several experts, my understanding, prepared to testify, and I'll turn it over to Patrick Neville, former Republican leader of the Colorado House of Representatives.
We do have one quick question for you, Representative Tisdale.
Well, I can wait if there's more people to testify, and perhaps my question will be answered, or I can figure out which one to ask the question to.
Yeah, we have two legislators and two experts on the issue. So.
All right, very good. Just let me know, and we'll get your question answered if it's not. Next up, then, we have Patrick Neville, former Colorado legislator, on Zoom. Patrick, welcome. The floor is yours.
Well, thank you for having me. I'm Patrick Neville, as mentioned. I used to be the House Republican leader in Colorado, and to say I was a Republican leader, that also means I was the minority leader. And I think it's safe to say that even I did not have a strong reputation for being a bipartisan legislator in Colorado. I think that's probably an understatement. But even I was able to get this bill passed in 2022. It's almost the same exact identical bill. And so it's interesting. In Colorado, this bill went into effect in August of 2022. Some of the things you might be hearing is this might lead to a bunch of lawsuits. Well, in practical application in Colorado, this bill has only led to 2 lawsuits that I'm aware of. What this bill does is actually give some power to the consumer, to the patient, to remedy some of these situations. An actual example that happened: patient went in, got an estimate, was told their out-of-pocket costs were going to be $1,500. Later on, she was billed $70,000 plus an additional $10,000 for anesthesia. She was able to use this and say, well, if you send me to collections, I will have recourse. The hospital came back and told her, you were correct, our mistake, billing error, $1,500, and she paid her bill. So that's what's actually happening, is it's actually giving some consumers some recourse. And since we actually have almost full compliance because of this law in Colorado, it's created a bunch of people that have been out there developing some of these tools. I myself was able to use this. My daughter was in a severe car accident. She needed an MRI because she had a really bad concussion. The hospital I was referred to, and I'm on TRICARE, being medically retired from the military, so I knew it was going to be a $38 copay for me regardless. But I was able to, the MRI that she was referred to was going to be $3,800 plus a facility fee. Well, I was able to find an MRI that actually got her in 2 weeks earlier, 5 minutes from my house, and it was $400. And so just in that situation, I was able to save the taxpayer thousands of dollars. And then what's even more important about this is businesses are starting to get smart since they're the largest payer. And they're starting to use these tools and encourage their employees to shop around, saving them thousands and thousands, sometimes cutting their healthcare costs for their employees up to 40% while getting better coverage. And so I would encourage you to really support this bill. I think, as was said earlier, it's not the silver bullet. And what I like to say is price transparency is not going to solve all the problems in healthcare, but nothing can be solved without it. And so with that, I'll sit back and I'll be available for questions.
Any questions? Representative Tisdale.
Yeah, with your experience, so there are thousands and thousands of billing codes. And what the bill calls for is 300 shoppable services and 70 services specified by CMS. So the thousands, and I don't even know what the total number is, 15,000, 20,000 different billing codes. So that's compressed down to 370 shoppable.
No, so the bill, that's what's in the bill that codifies that portion of the federal regulation. There's two portions of the federal regulation. You actually have to do the 300 shoppable services, but then you have to do a machine readable file with all of your prices. If it's the service that's offered, you actually have to put a price for all of your codes. And so that's what the federal rule does. What this gives recourse for patients on that. And so you can actually find any code that's billed and actually compare it to the machine readable file. And what some of these tech companies are doing is they're starting to take all that information and actually develop like a Google Flights or an Expedia of healthcare. So companies can actually go out and give these tools to their employees and they can go shop. And then there's other people doing direct to consumer, the same thing. And so that's the portion that I think is codifying just in the substitute is just the 300 portion. But then the federal rule also requires it for all services that are provided.
Okay, I've looked at the pricing list online for one of the local hospitals here. The billing codes weren't in numerical order. The procedures weren't in alphabetical order, and they were posted, but it was worthless because you could scroll through thousands of billing codes all day long and not have any idea of what you were looking at. But yeah, the information has to be accessible, not just posted. And so it's that search engine or that consumer-friendly ability to, and you're not going to shop if you're lying on the side of the road after being hit by a car. But if it is a total knee, you've got time to shop around for that. And I had a very similar experience with a CT scan. But yeah, that's all I want to ensure. Thank you.
Thank you. Thank you very much for being here. We have Representative Meerman. I'm sorry.
Thanks again, Chair, for indulging me. Patrick, appreciate your work on this. Could you just lay out some of the outcomes? Like, what are other states seeing when this happens, when this transparency, when customers can see what the bill is, what the bill is going to be? What happens?
Yeah, there's great outcomes. It's typically the employers that are getting smart and really taking advantage of this, because once they can actually see the data, and a lot of them are self-insured, and so they're actually paying for these procedures themselves, and they can actually take the data and steer their employees to a less cost procedure. So for an example, like there was an employer that was able to look at it, and a full knee replacement at one hospital was going to be $6,000. You went to another hospital, it was going to be $50,000. And so what they're doing is giving their employees incentives, saying, well, hey, if you go to this hospital instead, we're going to cover your deductible, even give you more money into your HSA, just directly to it if you go to this hospital. And it's a win-win because the employee saves their deductible, they get more money in their HSA, and then the employer wins because they're saving. You talk about that much of a price spread, and that's not uncommon. A lot of these procedures, and like the thing was mentioned before, over 90% of procedures are planned. And so only 10% are the actual emergency procedures. And so when these employers can do that, it's a win-win for the employee and the employer.
Thank you.
Thank you very much. Oh, Representative Bierman.
Thank you, Mr.
Your
Chair.
line, excuse me.
It works.
roll them together.
Is there any contingency room in? So if the procedure says that it's going to cost, it's some sort of surgery and it's going to be $20,000, and then there's complications, and now it's $30,000. Is there contingency to show that there was cause for more expense?
Yes, and so the big thing with the machine readable files is, say I go in for a shoulder repair or something, and then something happens with my heart. Oh my gosh, that's a completely different procedure. So that could happen during surgery. Something happens, there's complication, there's heart, but then there's a different code for that. And that's why it's tough to get like all these machine readable files and actually parse them out. But in that situation, they would be able to bill that other code. So if something happens in mid-procedure or even during the procedure that makes it more complex, there's an additional billing code for that, and that would be allowed to be billed.
Okay, thank you.
Well, thank you very much for taking some time out of your schedule and being here today. We appreciate it.
Thanks for having me.
Next up on Zoom, we have Steve Fenberg, former Colorado legislator. Steve, welcome. Anytime you're ready.
Well, thank you. Thank you, Mr. Chair and members of the committee, and thanks for taking the time on this important issue. My name is Steve Fenberg, and I served in the Colorado legislature as well with Patrick. I can confirm all of the things he said about himself early on in his testimony, but this was a bright spot and something that was very rewarding for Democrats and Republicans to work together to do something that's really in the interests of Colorado consumers. So I served in the legislature for 8 years. I recently termed out in January. In other words, I used to be somebody important, but now I'm working on issues that I'm passionate about. And healthcare price transparency is one of them because of the success that we've seen in our state. And the reason why I really love this issue is because, number one, it works. We've seen that the outcomes are very positive. And number two, it's a bipartisan issue. More than 90% of the public supports this issue. And in this day and age, it's kind of hard to find something that everybody pretty much across the board agrees with in politics. Here's how I know it works. There's a federal rule, as we've discussed already in this committee. Its origins are actually in the ACA. That requires every hospital in America to post their prices on their website. It's been supported by the Biden and the Trump administrations since it was implemented. However, the enforcement is pretty spotty at a federal level. And so compliance nationally is quite low. So they are required to do this. However, each hospital is probably doing it in a different way, and full compliance is quite low across the country. So Colorado passed a bill several years ago that gives patients, essentially what it does is it gives patients recourse for when they are charged for a service and the patient had no ability to know the price of that service on the front end. So recourse for when the hospital is not in compliance with those federal regulations. The result was that compliance actually shot up almost immediately. And the vast majority of hospitals in our state became compliant, and therefore consumers had access to prices. This policy works. And like I said, it's bipartisan. In Colorado, the bill passed, I think, nearly unanimously. It was sponsored by Patrick, who was the minority leader, as well as the Democratic majority leader, together at the same time. Ohio recently passed a similar bill, and it passed unanimously. Just a few months ago, the state of Nevada, as well as Oklahoma, both passed bills that are very similar, although probably a little bit stronger than the one that you're contemplating today. And those obviously passed in very different states. And then Senate Bill 95 doesn't put any... Okay, just a moment. Sorry, my children are at home with me still, so they're interrupting me. But Senate Bill 95 doesn't put any additional requirements on hospitals than they're already obligated to be doing under federal rule. The difference is that the bill gives patients a recourse if the hospital isn't following those existing rules. So as Patrick said, the spread between from one patient to another for a very similar procedure, depending on the hospital they're going to, can vary greatly. That can, result in whether the patient is getting a bill that they absolutely can't afford versus one that they can manage. This policy has been implemented in red states and blue states and western states and eastern states. Michigan should follow their lead and pass the law to empower its consumers. Whether you're a Republican or a Democrat, rural or urban, this policy is the right thing to do for Michiganders, and urge the committee to do so, and happy to answer any questions. And I'm sure my daughters would be happy to answer questions if there's anything relevant for them as well.
Well, Steve, I appreciate it because they're stealing the show right now, and that's the way our children should. But I'm sure that there's a few committee members that would love to ask some questions to them, but we'll probably leave them off the hook. But anybody on the committee have any questions today? We don't that I see right now, but I want to say thank you for your time, and you know what, you enjoy your day with your daughters, and that's the best job you could ever have right there, and congratulations on that, and thank you for your service, and we look forward to continuing to work with Senator Lindsey on this issue. So appreciate your time today. Next up, Ilaria Santiago, patient's right advocate on Zoom, wanting to speak. You can help me and let me know how bad I did on that name, but thank you very much for being here.
It's a different one. It's Ilaria Santangelo, so you weren't far off. But good morning, Mr. Chair and members of the committee. My name is Ilaria Santangelo, and I'm the Director of Research at patientrightsadvocate.org, a nonprofit, nonpartisan organization seeking real prices, real choices, and a functional marketplace in healthcare. We strongly believe that the single most important way to achieve this is through system-wide healthcare price transparency. I'm here to speak in strong support of Senate Bill 95. This bill ensures that hospitals cannot pursue medical debt collection actions against patients if they were not in compliance with the federal price transparency regs at the time of service. It's a simple principle. If you don't show the price up front, you shouldn't be able to collect afterwards. Healthcare is one of the only sectors of our economy where people are expected to buy without knowing the price up front. We don't tolerate this elsewhere, and we must stop accepting it in healthcare. As a nation, we have over 100 million Americans in medical debt. It's one of the leading causes of bankruptcy in our country. And over 1/3 of Americans are delaying care due to fear of unknown costs. We owe it to everyone and to Michiganders to do better and empower patients to shop for the best quality of care at prices they know they can afford. Transparent pricing allows Michiganders to compare prices and quality before getting care, budget responsibly for medical expenses because 90% of care is shoppable and non-emergent, avoid crushing surprise medical bills, and most importantly, get the care that they need, ultimately allowing them to live longer, healthier, and wealthier lives. When prices are hidden, hospitals can charge whatever they want. Families are then stuck with crippling medical debt, competition suffers, and trust in our healthcare system erodes. This is not placing additional burdens on hospitals. Hospitals have been required under federal law since 2021 to post their prices. Unfortunately, compliance has been uneven, and many Michigan hospitals still fail to post clear, accessible, and transparent pricing. In our recent semi-annual compliance report, only 2 out of 53, which is 4%, of Michigan hospitals were fully complying with the federal regulation. This bill gives the federal reg real meaning. It creates an incentive for compliance by linking transparency to a hospital's ability to collect medical debt, and it also ensures hospitals cannot bill different amounts other than the ones recorded in the machine-readable files, and this is a problem we see across the board. That's fair, and it holds institutions accountable without imposing new burdens on hospitals or patients. It's not anti-hospital, it's pro-consumer and pro-accountability. It simply says if you want to collect money from patients, you must first be transparent with them about what the costs are. We strongly support this bill. Every Michigan family deserves to know what the healthcare costs will be before they walk through hospital doors. This bill not only promotes price transparency, but it will also allow patients to take care of their physical health while protecting their financial wealth. Thank you.
Thank you. Questions from the committee? I'm assuming you've helped several states with this legislation. Is that correct?
Yeah. Yep.
Recent one, Ohio.
Yes.
Can you give us just some tidbits of what you saw in Ohio and what benefits they've accomplished through that legislation?
Yeah, so what we were able to do in Ohio, which is really exciting, is create a shopping tool for all Ohioans instead of having to use these machine readable files, which, they are large. They're not totally consumer friendly. And I don't think someone like my mom or dad would have that, great of a time using them. So we created this database that pulls all of the information posted in the machine readable pricing files. So instead of going into the file, you can go on our tool, type in whatever billing code you need, whether it's an MRI, an X-ray, or something like a heart surgery, and we pull all of the prices posted by that hospital for that item and service. So we're able, once the pricing information's out there, we're able to create consumer-friendly tools that just makes, this pricing data accessible to everyone.
Very good. Thank you. Seeing no other questions, I want to say thank you for your time today. Appreciate it very much.
Thank you.
Next up on Zoom, Christian Deacon Author Verson Consulting. Is he on? Should be. Maybe not.
Yes, thank
Oh,
you.
there you are. All right, the floor is yours.
Thank you. Chair and members of the committee, thank you for the opportunity to testify today. My name is Chris Deacon, and I previously served as the Director of State Health Benefits for the state of New Jersey, where I oversaw the health benefits program for over 800,000 public sector lives. I've also recently testified before the U.S. Senate Help Committee, as well as the House of Representatives Committee on Aging, on healthcare affordability and price transparency. I'm also the author of the recent book, The Great American Healthcare Heist. The affordability of healthcare remains a dominant, obviously, fiscal concern at every level of government. And even as federal policymakers debate budgets and shutdowns, there is virtually no discussion of the underlying prices that drive spending. And that's largely because those prices have remained hidden. More than 4 years after passage of the federal hospital price transparency rule took effect, compliance remains inconsistent and enforcement not only uneven, but essentially non-existent. Without transparent pricing, as my colleague Patrick Neville mentioned, efforts to constrain or rationalize healthcare costs are structurally impossible. Michigan's data clearly demonstrates the urgency of this matter. The Department of Insurance and Financial Services, I read recently approved, or not recently, for last year, approved an average premium increase of 10 to 11% in the individual and small group market, with preliminary 2026 filings indicating potential growth up to 20%. And I've certainly confirmed that with several employers, large employers and unions that I have worked with in the state of Michigan. Hospital and facility prices are the dominant driver of these increases. According to RAND, Michigan hospitals are largely reimbursed at twice the federal benchmark, with very wide intrastate variation that cannot be explained by case mix or quality metrics. Transparency is essential to identifying and addressing that variation. What this bill does is aligns compliance with consequence by prohibiting hospitals from initiating collection actions on debts incurred for periods of non-compliance with the law. It is narrow, it's targeted, and this enforcement mechanism supports, not supplants, federal rule and regulation. I have testified before state boards at the federal level and state legislatures on numerous occasions on this topic. And one of the, there are 4 arguments that typically are raised in opposition, and I'd like to address those, should they be raised. Hospitals often argue that compliance is complex. Yet CMS has published very detailed technical specifications, and hundreds of institutions nationwide do meet them. Obviously, there's no other sector of the economy that would be permitted to obscure prices on the grounds that disclosure of those prices is administratively inconvenient or burdensome. There's also often the assertion that patients will not use the data or misunderstand its purpose. Price files are not solely consumer tools. They are essential for employers, unions, public purchasers, etc., who then aggregate and analyze that pricing information to inform their contracting and purchasing decisions. Some have asked, what happens if something unexpected occurs during a treatment? A valid question, but it doesn't undermine the principle of transparency. Every service, test, and intervention already has an established price. And so the purpose of transparency is not to demand advanced prediction of every known clinical contingency, but to ensure that when those contingencies occur, the prices are known, published, and accessible. Price transparency does not interfere with clinical judgment. It ensures financial accountability. And then finally, litigation risk. Hospitals and hospital associations often express concern about legal exposure. In reality, the current litigation imbalance runs in the opposite direction. Thousands of Michigan patients face wage garnishments, liens, credit damage arising from medical debt. A report by the Pew Charitable Trust found that in Michigan, about 10% of all debt collection lawsuits filed in the state from 2010 to 2021 were brought directly by medical providers. What this bill does is simply ensures that hospitals demonstrate compliance with existing law before invoking the courts against individual patients. We know that transparency is not a panacea, but no viable cost containment framework can succeed without it. This enforcement mechanism, tethered to pre-existing federal obligations, can enhance accountability and protect patients and purchasers from the consequences of opacity and no transparencies. So for these reasons, I would respectfully urge the committee to advance Senate Bill 95. Thank you, and I'm happy to take any questions.
Well, thank you very much. We do have a question. Representative Meerman.
Thank you again, Chair. Could you restate the percent Michiganer receiving health care are overpaying compared to the rest of the nation?
Yes, the RAND study found that Michigan payers are paying twice what the federal rate is. So that would be around 190 to 200% of CMS for their healthcare, inpatient and outpatient services facilities.
Thank you.
There's a RAND price transparency study that is publicly available, and they've been putting this data together for several years.
Thank you.
Thank you. Any other questions from the committee? Seeing none, thank you very much for your time today. We appreciate it.